Thank you so much, Carol, and everyone at the Clinical Effectiveness Group for helping to organize this seminar. Yeah, as Carol said, my name is Michal. I'm a postdoc at the University of Glasgow, and as of today, a fellow for the British Academy, starting my postdoc fellowship. My project goes on for 3 years. I have 36 months of funding. So I'll be continuing until September 2028. And the main aim, really kind of like the bulk of my project, what I'm going to be focused on for most of the next 3 years, is an evaluation of energy efficiency measures in Scotland, looking at the health effects for adults over 65 and children under 5. These are the groups that I think everyone probably knows are most susceptible to the harmful effects of poor housing, partly because of their physiology, but also because of the time spent at home. And I'll be using linked household and individual level data to conduct this evaluation. And given everything that we know about housing and the people we live with and how that affects our health, underpinning this project and most of what I'm doing while I'm waiting for my data very patiently is a lot of ongoing engagement, trying to explore future uses of linked address level and individual level data sets. So today I'm going to give an overview of my evaluation plan as well as lay out the scope of the engagement activities. So I'm not going to go into a lot of detail about housing in Scotland because it's probably not that dissimilar from housing across the rest of the UK. There are 2.5 million domestic properties in Scotland, half of which are in critical repair and over half of which have a below EPCC, so what's considered standard of energy efficiency rating. Our homes are old, so 70% of Scotland's 2.5 million homes were built before 1982, but more than 85% of the homes that are in critical repair, so like critical structural needs, were built before 1982. So there's really a lot of work that's needed to improve housing in Scotland. And for in terms of the government support available, government support for improving for improving housing is devolved. So Scottish government funds a range of programs under their heat and building strategy. This includes both domestic and non-domestic properties. But for domestic properties, the types of things that are available are like advice on how to reduce energy consumption and loans if you want to make your own improvements, and also support for social housing. But I'm going to be focused on two programs that provide support for private sector housing, the area-based schemes and Warmer Home Scotland. These programs are pretty similar. They are both aimed at reducing fuel poverty. So they target some of the factors that drive fuel poverty, namely income and energy efficiency of homes. So you can kind of think of eligibility for these programs in terms of property characteristics, again, mainly EPC below C, and also the household financial circumstances, and whether they're at risk of fuel poverty. Both of these schemes are funded by Scottish government, though area-based schemes, which delivers most of the improvements to households to private housing sector in Scotland, also utilizes some of the funding from energy company obligation funds, because these area-based schemes, as kind of the name suggests, are delivered by local authorities. But also there is, again, just kind of flexibility because the managing agent of these programs change work. So if you apply for Warmer Home Scotland, you get rejected because you haven't kind of just met the criteria for receiving a certain benefit. They might then direct you to area-based schemes. So they really sort of work in tandem. The other important differences to know is that for Warmer Home Scotland, you are applying for support. And as I said, yeah, go through ChangeWorks. And even if you're not eligible for Warmer Home Scotland support, you might get shifted over to area-based schemes. Whereas area-based schemes, you are targeted by local authorities. They look at areas. So on, the smallest here would be called the lower super output area in Scotland, data zone level areas to see which are in high risk and high need of repair, risk of fuel poverty, and then they target and identify them. And over 160,000 properties, domestic properties, have been improved through these schemes, and they account for over 50% of the heat and buildings budget for the upcoming financial year. And this number is only expected to rise. So how we're actually going to get a causal estimate of the energy efficiency measures is a pretty straightforward difference analysis. So we're going to look at the health of children under 5 and adults over 65 who have any of the outcomes that we're interested in and are living in homes which have been improved by Warmer Home Scotland or area-based schemes. Look at their outcomes from 2015, which is when the programs were introduced, until 2028, and then compare their outcomes to projected trends from 2009 to 2008, and then also to account for some of the contemporaneous differences that might have happened at the same time. So things like winter fuel payment, changes of winter fuel payment, and it's like COVID. We are going to compare them to under 5s, over 65s with the health outcomes that are living in homes which have not been improved through Warmer Home Scotland or area-based schemes. In terms of where we're actually getting this information, I'll talk more about that in a minute, but just to say that the Home Energy Efficiency Database, that's the database that lets us know whether or not you've received any of these measures, and we are going to be looking at energy performance certificates to see kind of broadly, would you have been eligible for Warmer Home Scotland or area-based schemes. And as you can see, there will hopefully be quite a big sample size, and hopefully the study will be quite powered. These are estimates, kind of back of the napkin, but we're estimating that around almost 90,000 under 5s and over 65s are going to be living in any of the improved homes, and over 660,000 in any of the homes that might have been eligible to receive these improvements, but haven't for one reason or another. This is going to be a pretty big data linkage project. So I've already submitted my data access application, so it's nice to kind of be able to synthesize this. But we are bringing together individual level health records and address level property data sets, and from population-wide data. All of these are population-wide data sets, and how we're going to link across individuals and the places that they live is through the CHI UPRN residential linkage lookup file, which helps bridge between community health index numbers in Scotland. So these are unique personal identifiers, the equivalent of NHS numbers, and unique property residential numbers for households for everybody who is registered with a GP in Scotland from 2000 onwards. The exact number of people who are registered to GPs is a little bit difficult to get because it's often higher than the population, but yeah, it's pretty high. And we've asked for data for adults over 65 with the outcomes for things from hospitalizations. So these are inpatient and outpatient hospitalization records in Scotland. Prescriptions. So the prescriptions in Scotland are those that are dispensed in the community. The prescription information is what's dispensed in the community because prescriptions are free in Scotland, and death records. And for children under 5, also looking at hospitalizations, prescriptions, and then outcomes at their 27 and 30-month surveillance for health visitors, their immunization records, and the dental accounting system, which is a dental claim system for people who go to the dentist in Scotland, whether or not they're paying. And most of the children at this age probably aren't paying. It'll be free. And because we know that for many of the outcomes that we're going to be looking at, they are affected not only by the houses that they live in, but the people that they live with. We've also requested some co-dweller information. So for older adults, hospitalizations and prescriptions, and for children, also interested in their parents. So maternal health behavior at birth and child health at birth. And for the evaluation to actually see who the homes that they live in and whether or not they would be eligible for Warmer Home Scotland, we are going to be looking towards energy performance certificate records, and for whether they have actually received the evaluation, we'll look towards the Home Energy Efficiency Database, and that has the date that the measure was installed in someone's home, the scheme, so whether it was Warmer Home Scotland or area-based scheme, and what was actually done. So it's a pretty kind of broad range: insulation, heating, fuels, heating systems, wall construction, renewables. And we'll be able to do that and conduct an evaluation. Before I go into the outcomes that we'll be looking at, I just kind of want to say that the outcomes, we have a lot. It'll be a real whistle-stop tour, but sort of the main thing that's bringing them together is outcomes that we know are related to the homes we live in, and we know that they are related to living in poor housing, but that they are somewhat underexplored in the energy efficiency measure and health evaluation literature. So what I mean by that in practice is for adults over 65, living in poor quality housing is both expensive. It's, expensive to heat a home with old appliances, with inefficient fuel sources, with old boilers. And it is also making their home not only cold, but also the temperature is really unstable. So it's can either, can sometimes be too hot and too cold, and that's affecting their heart health. So as a result, we're looking at cardiovascular disease and all-cause mortality, and also affecting their dexterity and mobility within the home, which is also affected by having a bunch of hazardous old appliances kind of lying around. And again, energy efficiency measures that kind of aim to improve these, we theorize will also reduce the number of unintentional injuries, of which over 65s account for the vast majority of in Scotland. And of course, I think something that's kind of pretty well established is that living in energy inefficient homes, poor quality housing affects damp and mold, creating a higher risk for respiratory disease. We have measures for the outcomes and the energy efficiency measures that they received or have not received in kind of the comparable homes. But what we don't have is for the underlying mechanisms that link between the both. What we do have, though, are measures that will hopefully account for some of the confounding variables that determine whether or not you are likely to apply and receive energy efficiency measures, and also have any of the outcomes. So, for example, baseline health and socioeconomic factors, when councils are looking, when the application is looking, they're looking at kind of, overall, how is your health? What is your risk of fuel poverty? And they're taking these factors into account. And because for socioeconomic factors, we do not have individual or household level income data, we are going to be taking a multitude of measures. And these include things like area deprivation, so Scottish Index of Multiple Deprivation, living alone, because that is something that also increases your likelihood of getting support, and overcrowding, though that's probably not quite as likely for over 65s, but we'll have a look at that as well, and the effect that that has on, yeah, accounting for the effect that that's going to have on health, and also likelihood of receiving treatment, of receiving, yeah, improved energy measures. Um, there are also a bunch of factors that we think are probably going to modify the effect that energy measures will have on health. So these are environmental and geographic factors, things like energy consumption, prices, amount of properties off the gas grid. So that is related to the likelihood of getting support for fuel poverty, as well as the degree of rurality. These measures are provided by the Department for Energy Security and Net Zero, and we're going to be giving them to Public Health Scotland and asking them to link. I should say, like, these are area level measures. They're updated once a year. They're not, I would have probably liked to include them as a potential confounder for some of them, but they're just not updated frequently enough. So we have them now. We think that if, we have kind of rurality after a home was improved, then it's potentially likely to be, yeah, an effect modifier, but that's something that's going to still get hashed out. The other really important factors that are going to determine kind of what effect the energy improvement measures have on the outcomes that will modify the effect that it has, are the characteristics of the actual energy efficiency measure. So this is the type of measure. There's a lot of disagreement and debate in the literature around whether kind of retrofit, whole housing, fabric first, what approach is best for improving housing. And so we'll be able to look at that. And really importantly, we'll be able to look at duration of exposure. So we will have the date that a measure was installed, the date that you're registered at the GP and registered at the address, and then the date of your outcome. The same kind of structure of relationship applies to respiratory diseases for over 65s, except for that we are also, oh, sorry, there should be another arrow from household respiratory health to improved homes. But we know that that many of the diseases that that are over 65s that we're interested in will get are also those that are transmitted within the home. So we want to make sure to account for that. And again, because when you're applying for energy efficiency programs or when you're kind of looking, councils, local authorities looking to see whether you're eligible for them, they are taking the whole household into account. And so you could be living with someone who is, yeah, at high risk of fuel poverty, even if kind of you yourself aren't necessary, even if you're not susceptible to the adverse effects of that home. And so that's where we want to account for household respiratory measures. Yes. And so for children under 5, we are looking at a range of outcomes. Many of the ways that for children under 5, the living in poor quality housing affects their health. A lot of it is through their parents' behavior, so it's not necessarily something that kind of they're changing in their behavior. And so we are kind of looking at something like dental caries and registration treatment and primary early years immunizations. The idea is that parents who are living in the evidence suggests that parents who are living in homes that are poor quality, that are expensive to heat, is creating quite a lot of psychosocial stressors that are making health promoting behaviors more difficult to achieve, particularly for those with low income. Again, those are the types of households that would be eligible and that these programs are targeting, that ABS and Warmer Home Scotland are targeting. And so we're going to be looking at that and also at developmental concerns at 27 and 30 months. What's also really important is not just how parents are, but the space that children have to grow and to develop and to play. And so that's where, again, energy efficiency measures can just kind of create more space for kids to be around, and they are also safer spaces, which is why we are looking at both developmental concerns at 27 to 30 months. So that's when health visitors come into the home. Universal checks around that. In Scotland's pretty high rate of completion, and unintentional injuries, hospitalizations for that. For children under 5, we are also looking at the effects that potentially getting improvements through energy efficiency measures would have on allergy and skin conditions. And yeah, there is another project that's looking at respiratory health outcomes for children. So we didn't want to replicate that, but that is something that is being looked at. Just to go kind of briefly through the analysis plan for under 5s, as I said, that a lot of the behavior, a lot of the effects of living in poor housing on children is happening sort of through parents. They're just at that age where they're very susceptible to parental behavior, parental health. And so we really need, and obviously children are not the ones applying for any of these energy efficiency measures. So we have requested from Public Health Scotland that we, for all of the children with any of the outcomes of interest, we're also getting maternal health records at birth. So this is from SMRO2, and that's where we'll be able to adjust for a couple of key confounders like age at first or current birth, smoking during pregnancy, um, and we will also be able to adjust for a child's health at birth with the kind of the theory behind this and the concept that having children who are potentially at higher risk for some of these outcomes might make parents more likely to apply to improve these programs, or they might be encouraged more to apply. It might be targeted more by local authorities. Similarly, for older adults, we are adjusting for socioeconomic factors, and we have here parental class and education, so maternal and paternal, from the birth records, as well as a couple of area level measures. So things like child poverty. And again, also going to be looking at overcrowding, and number of habitable homes will also be relevant here as we think, kind of make sure to account for as many factors as is reasonable and as, good enough data that affect both getting the energy improvement and their health. For allergy and skin, we have also outcomes prescriptions that have been dispensed in the community. We have also requested overall household allergy and skin conditions. These aren't transmitted, but these are potentially genetic conditions that the index trials that we're looking at might also have. And so that's why we want to make sure to adjust for them, because also, again, it might be part of the reason that somebody is applying or receiving Warmer Home Scotland or area-based scheme support. So that is the evaluation plan, and it is, yeah, as I said, kind of take up most of my time. But sort of while I am waiting for my data and kind of thinking about what else we can kind of do for these household and individual linkages, I've been wanting to look at other data sets that we could have brought in. Uh, so I'm particularly interested in housing affordability. This was in kind of the initial draft of my project, was to draw in Zoopla data. So Zoopla, as I'm sure most people know, this is one of the main websites through which people rent and post rent and sales of houses. The Urban Big Data Center in Glasgow, the head of that center is one of my advisors on the project, Nick Bailey. Their team has Zoopla data, but we just kind of deemed that it wasn't probably sufficient for actually counting for affordability, because it really is just the sticker price. It's not necessarily what people are actually paying, and that we didn't have a good sense of. And similarly, Registers of Scotland. So this is the equivalent of valuation office agency here, for housing prices that are sold. Really wanted to bring that in, but it was not possible. They said no. So I'm going to keep trying for the next couple of years, because it would be really, really useful to get a housing affordability measure. It seems that those are the two routes, at least most viable in Scotland. The other thing that I'm really interested in is looking at duration or stability of tenure. So something that's talked about a lot in Scotland is eviction and tenants' rights. There's been a lot of legislation around that. And so it would be really useful to actually see how long somebody has been living in a home and what effect that has on health. We'll have duration of tenure in our evaluation, but because these are based on GP registrations, it's not necessarily good enough for the exposure, the kind of main thing. So I need to do a little bit more kind of quality check around that to see if it would be of any use. And the other thing is that would be really useful, and I know that's being done a lot here at the clinical effectiveness group, is looking at overall household composition. And the Scottish government has 6 priority family groups that are at high risk of child poverty. And so some of them, like lone parents and large families, these might be able to be identified using crawl. And so with all of that, I am sort of underpinning the project is going to be this public and stakeholder engagement activities, where we are asking kind of what else can we do with these household and individual linkages? Can we bring in some of these other data sets? And so I'm first going to be sharing my findings from a systematic review that I'm just finishing up of energy efficiency measures and health. And hopefully that might point us towards the next step, which is what data are available to actually measure properties that might be relevant. So kind of seeing from the review, what might we want to look at next. Then do, yeah, the mapping available data. So scoping exercise of seeing what is out there, what else could potentially be linked, what have people written about it, how high quality is it potentially. I should say I'm starting with nation level. We're looking at UK wide, but I'm going to be starting at nation data. This might be, maybe that's a mistake. I think because I'm from Scotland, I live in Scotland. I'm sort of looking nationally, because our population is mostly around the central belt. And so, if we want to account for things like rurality, we also have a smaller population, so it's probably a little bit easier to do, that we are looking nationwide. But I'd kind of be interested to hear if people that would if having national level data that can be linked is relevant, for councils, if it is kind of that more granular that's needed. And then sort of as we start having findings, start to conduct some stakeholder engagement, get some feedback on maybe our proposed questions, co-produce some questions, and then get feedback from the public on what their priorities are. Just to wrap up of where I am and kind of where and when I hope to be. As I mentioned, I've submitted the data access application. There is hopefully not a super long lag time, but I'm kind of conservatively hoping that within a year it will have been approved. So it's now just waiting to get assigned to a research coordinator, and then it goes to the panel for review. And that might take some back and forth, but I'm hopeful. Finalize my systematic review and finalize an analysis plan for the evaluation and publish it. And so that's what I'm going to kind of be doing in the next couple of months, as well as starting some of that public engagement activity. And yeah, I think that's probably it for me. All is just to say thank you so much. And yeah, I'm excited for your questions.